How to answer. Tell us about a mistake you made in medical interviews. If you're listening to this, chances are your palms are already a little sweaty thinking about that question, the one that makes every medical interview candidate's heart skip a beat. Tell us about a mistake you made. Relax. Today, I'm going to show you exactly how to nail this answer and turn what feels like a trap into your secret weapon for standing out. Hey, future doctors, welcome back. I'm here to help you take the fear out of medical interviews. And today, we're tackling one of the most misunderstood questions you'll face. By the end of this, you'll know what the panel is really looking for, the biggest mistakes candidates make with this, and I'll give you a bulletproof framework with real examples you can adapt for your own interviews. Let's get inside the heads of your interviewers for a second, because when they ask about your mistakes, they are not trying to catch you out, or embarrass you, or make you look incompetent. Here's what they're actually testing. Number 1, self-awareness. Can you recognize when you mess up? No one's perfect. They know that, but they want to see if you can reflect honestly. Responsibility. Do you own your mistakes, or do you throw your colleagues under the bus? Big difference. Number 3, problem solving. How do you fix things when they go wrong? They want safe, proactive doctors. Number 4, learning. Do you actually grow from your experiences, or do you keep repeating the same errors? And number 5, safety. Ultimately, they want to know, are you someone who can be trusted with patients, especially under pressure? Here's the reality. If you sit there and say, I've never really made a mistake, congratulations, you've just scored 0 on self-awareness, and you've made the panel question your honesty. Let me save you from the most common disasters I see with this question, the perfectionist trap. Saying, I can't really think of any mistakes. That tells the panel you lack insight, or worse, that you're trying to cover something up. Mistake number 2, the blame game statements like, well, my supervisor didn't explain it properly, or the system was confusing. You've just shown that you deflect responsibility, and that is a massive red flag. Mistake number 3, the catastrophe story, going straight to, so this patient died because of my error. Whoa, pump the brakes. You're supposed to show growth, not terrify the panel about your clinical competence. The sweet spot for this answer, a mistake that's personal, had real consequences, but crucially, shows you handled it professionally, and you learned from it. So how do you structure this without rambling, panicking, or missing key details? You use the STAR framework with a medical twist. S for situation, set the scene briefly. No need for an anatomy lecture. T for task. What was your role, and what went wrong? A for action. This is your gold mine. What did you do to fix it? R for result and reflection. What happened? And more importantly, what did you learn? And here's the key most candidates miss. In your action section, you must cover the clinical steps you took to keep the patient safe, who you involved from the team, how you communicated with the patient or family, and any incident reporting you completed. Let me show you exactly how this sounds with a real example. During my placement in the emergency department, I was tasked with giving a patient IV fluids. It was a busy night shift, and I was feeling the pressure to work quickly. Task and mistake. I grabbed what I thought was a saline flush from the medication cart, but in my haste, I didn't double-check the label. I realized immediately after injecting that I had used lidocaine instead of saline. The labels looked very similar. Action. I immediately stopped the injection, moved the patient to the resuscitation area, and called my registrar over. I explained exactly what had happened. We put the patient on cardiac monitoring, and I stayed with them to watch for any adverse reactions. Most importantly, I went straight to the patient, explained what had occurred, apologized sincerely, and reassured them that we were monitoring closely and would keep them informed. I also completed a critical incident form that same shift. Result and reflection. Fortunately, the patient had no adverse reactions, but this experience taught me the critical importance of the 5 rights of medication administration. I now always double-check medication labels, even when I'm under pressure. I also raised this incident at our next team meeting, and it led to a review of our medication labeling system. Similar-looking medications are now stored separately, which has prevented similar incidents from occurring. Let's break down why that answer works so well. You've shown personal responsibility, no blaming others. You took immediate action to keep the patient safe. You communicated clearly and honestly with the patient. You involved the right team members. You demonstrated reflection and clear learning. You contributed to system improvements. And you completed the correct documentation. The patient was safe, the candidate learned, and the system improved. That's exactly what panels want to hear. Need more ideas? Here are other mistake categories that work brilliantly for this answer. Medication errors, like almost giving antibiotics to a penicillin allergic patient because you missed the allergy bracelet. Communication failures, assuming a patient understood a procedure when they didn't. Delegation issues, asking a junior colleague to do something without checking their competence. Assessment oversights, missing key information in a patient's history because you didn't review the notes thoroughly. The key? The mistake should be interesting enough to discuss, but not so serious that the panel questions your basic competence. Let me give you some quick red flags to avoid. Don't choose mistakes that clearly weren't your fault. Don't pick boring everyday slip-ups that everyone makes. Don't discuss cases where patients were seriously harmed. Don't forget to mention incident reporting. Don't skip the patient communication part. And don't focus only on the mistake. The reflection is where half your marks come from. So, how do you prepare your answer? First, choose your mistake, ideally from the last 6 to 12 months. Second, write it out using the STAR structure. Third, practice it out loud. It should be around 2 to 3 minutes. Fourth, focus on the learning. That's your biggest opportunity to impress. Finally, be ready for follow-ups. They might ask what you'd do differently now. Here's what I want you to remember. This question isn't designed to trip you up. It's your opportunity to show maturity, professionalism, and a commitment to patient safety. Every great doctor has made mistakes. What sets them apart is how they handle them. Your mistake doesn't define you. Your response to it does. Show the panel that you take responsibility, you learn from your experiences, and you always prioritize your patients. That's the kind of doctor they want to train. If this helped you feel more confident about tackling tricky interview questions, make sure you hit follow for more practical tips just like this. And if you've got an interview worry that keeps you up at night, send it my way. I love helping you turn those fears into strengths. You've got this. Now go practice. In our next video, we will demystify clinical governance for you. Stay tuned, hit that like button, and subscribe for more interview tips.